Hi, my name is Dr. Colette Brown-Graham. I'm an obstetrician gynecologist in the Wellington area, and I'm so excited that you're here and part of our program today. I wanted to talk to you about what it takes to be an OBGYN in these times. I have actually been an OBGYN for 35 years, and I graduated from medical school in 1988. I went to University of Miami School of Medicine, and of course it takes 4 years of medical school to become a doctor. But prior to that, it takes 4 years of undergrad, and most people go to a science program where they're either taking biology or chemistry, but you really can major in whatever you want to major in to become a physician. After you go to undergraduate, and one of the take-home messages is that you really should do well. So I always try to encourage people who I mentor to take classes that a few hard and a few easy. Don't pack your schedule with 4 difficult classes in one semester, because it will actually trip you up, because one of the most important things is to get good grades. The medical school does look on that, and it's really important that your grades reflect stellar work. So after the 4 years of medical school, I then applied for a residency program, and yay, I got to be a resident in Boston at Boston University for obstetrics and gynecology. Most obstetrics and gynecology programs are 4 years long. They take us through obstetrics and gynecology, which is actually an easy thing to mix because it's all female patients. We work in the OR, we work in delivering babies. I think my most important thing about obstetrics and gynecology that I really enjoy is that the work is never the same. Every day it's something different. So you have patients in the office, you deliver babies, you do surgeries, you do circumcisions on baby boys. It's a very exciting, different, you're talking to patients all day. So it's actually a very dynamic and wonderful profession to be a part of. I wish this were in person, because now I'd stop it and ask anyone if they had questions for me, because really and truly this is just kind of an overview and a brief sort of introduction as to what it takes to be an OBGYN. I think my biggest inspiration to become a physician is my mother, who was a nurse. My mom worked at Jackson Memorial Hospital, and I was really proud to see her going to work every day. I also have an uncle who was a physician, but he wasn't as involved with me as was seeing my mother daily. It's a fabulous thing to have someone in the profession, but the thing that you have to do if you don't have someone and you still aspire to be in medicine is you must get a mentor. I think a mentor is one of the best things you can do for yourself, because the mentor will help you, will guide you, will talk to you, will encourage you, will tell you, no, I don't think you should do this. So we at T. Leroy Jefferson actually provide quite a bit of mentorship, and that's critical, because there are people who are wanting to go to medical school, wanting to be doctors, and they're not really sure of the steps A, B, and C, and that's where mentorship is involved. So please don't feel alone. Please don't feel like you have to have a mother like I did or an uncle who's a doctor. You really can depend on a mentor to give you that extra boost, to give you that extra encouragement, to help you along the way so you too can become a physician if that's what you want to do. The other critical thing is a day in the life of an OBGYN. I kind of wish that I could tell you that I have a similar job every day, because I don't. Some days I go to bed at 4 a.m. in the morning because I've been up delivering a baby all night. Some days I actually go to the OR and do 2 or 3 hysterectomies. And some days I actually just see patients in the office. And I think for someone who wants to be an OBGYN, they have to like dynamism and excitement and really just being busy, busy, busy. I really still enjoy that. I think now that I'm getting closer to 60, it's exhausting me a little bit more. But I think when I first came out, I really was so excited about each day that with obstetrics and gynecology. So you have to be the kind of person that doesn't mind having your day vary from day to day to day to day, because that's really the true picture of an OBGYN. Just a very varied day, each day one to the other. So one of the more important things to remember is that there is monies available for those of us who have done well. It's really important that you understand that when people go, oh, you can't afford that, you can't afford to be a doctor, you can't afford to go to medical school, they're really not telling the truth. There are expenses that go along with an education, but there certainly are scholarships available. There are certainly ways to get an education without spending your entire life savings. And there's ways even to go to school and be a part of that educational environment without feeling like, oh my gosh, I really can't afford this. So I'm not going to give you specifics about what scholarship you can get, but I want you to know that being stellar in the environment that you're in, getting the best grades, doing activities in school, paying attention when people come and they say, look, be a part of this program because it can help you. These are things that would be very beneficial to you, and you should consider doing them because they can, in the long run, help you to go to school, maintain a great GPA, and also have most of the money covered for you to be in that academic program.